There's a new claim that Vice President Harris is pushing on the campaign trail, and quite frankly, she's doing it with the assistance of the legacy media. But the claim is that pro-life laws in Georgia are leading to the deaths of healthy women in that state.
Republican men, from Trump down to governors to state legislatures, assured us that they were protecting life and that these Trump abortion bans would protect the mother's life if it was ever in danger. But that's just another lie that they're telling you. ProPublica has been investigating how abortion bans across the country are affecting women. And guess what? It's killing them.
Wow. All right, that, of course, was MSNBC's Joy Reid on Wednesday. But listen, we want to set the record straight. An understanding of the medical details behind the deaths of these two women need to be highlighted, as well as the Georgia laws. And both of these combined tell an entirely different story than what Joy Reid is trying to put out there. So joining me now to help explain all of this is Mary Szoch. She's the director of the Center for Human Dignity here at the Family Research Council. Mary, welcome back to the program. It's great to have you.
Thanks so much for having me on, Jody.
Okay, so let's start. The story specifically of Amber Thurman has certainly become a campaign issue for Vice President Harris out there on the trail. But if you can, let's start with, if you would, just explain the background for those who may not be aware of this particular story.
Amber Thurman was a young mom in the state of Georgia. She was about 9 weeks pregnant with twins. She was unable to get a surgical abortion in Georgia because her twins had a heartbeat. She drove to North Carolina, and there, according to ProPublica, she was 15 minutes late for her surgical abortion. And so instead, they sent her home with mifepristone and misoprostol, the abortion drug, and misoprostol to expel the unborn child after it's been killed by mifepristone. When she returned home, she had taken the drugs and she was experiencing horrific pain. And we know that occurred for 4 days. By the time she got to the hospital, it appeared that she was suffering from sepsis. And she did not receive a DNC when she was at the hospital. And unfortunately, both she and her twins died. There are a couple of key facts here that people should know about this. First, Amber Thurman did not need an abortion when she got to the hospital in Georgia. She needed a DNC procedure to clear whatever tissue was left in her uterus. At that point, her unborn children would have already been dead. They would not have been alive. The second thing is that mifepristone, the abortion drug, carries with it a complication risk of incomplete abortion. In fact, at 9 weeks gestation, where Amber Thurman was, about 7% of women have an incomplete abortion, which of course can lead to sepsis. This is something that it's unclear if the abortionist who she visited in North Carolina shared with her. But what is clear is that they sent her home knowing that if she did experience these life-threatening complications, which are a hallmark of the abortion drug, that they could do nothing about it, that there was no way that they could help her. At fault in this case is the abortion business that profited off the death of her children, the FDA that removed the safety requirements for the dispensing of mifepristone, which would have led to her unborn children's death still, but would have saved her life, perhaps, and the doctors who were at that Georgia hospital. The last group that we must keep in mind here that's at fault is the media that's pushing this narrative that abortion, that laws that are protecting unborn children put women's lives at risk.
So you did not mention in all of those who hold partial responsibility in all of this, the pro-life laws of Georgia, and yet that is what the left is shouting is the responsible party behind all of this is the pro-life laws. That's just not true, is it?
No, there was nothing in those pro-life laws that prevented Amber Thurman from receiving care. When she got to that hospital in Georgia, she should have received a DNC. A DNC is a procedure that is sometimes used to kill an unborn child and sometimes used for other things, like clearing the uterus after a miscarriage. It is only illegal in Georgia if it is used to intentionally kill an unborn child. And this obviously would not have been the case for her. But the physicians there have an obligation to know that they are allowed to perform that DNC. And the media has an obligation to stop saying that they're not allowed to. ProPublica said that a DNC is illegal in Georgia. That is just false information, and they need to be held accountable for that.
Absolutely. I mean, that's why even watching, I don't know if you saw the clip of Joy Reid a little while ago, it's just absolute insanity what the left is claiming as the responsibility here. And it has nothing to do with reality or with the facts in this case. Mary, if you can, I'd like to hold you over to the next segment. I've got a few more questions for you. But I want to talk about, among other things, I've got a few questions for you, but I want to discuss how in the world can we effectively educate the public on all of this while we have the legacy media, pro-abortion politicians, and a host of others that are coming against us. I want to get to that after the break. If you would, please hang on. I want to carry over a little bit more. Mary, thank you, first of all, for staying over the break as we talk about this extremely important situation and heartbreaking, absolutely heartbreaking situation. So here we have a couple of ladies who have lost their lives, as well as the lives of their baby, obviously. But Amber Thurman, one of them, that Vice President Harris and the legacy media are pushing to promote the false ideas that Georgia pro-life laws caused their deaths, and just simply is not the truth. But how can we, Mary, educate the public when we have pro-abortion politicians, we have a pro-abortion legacy media, wind in our faces, pushing back against all the truth in this? What would you say when we are in this battle of trying to educate people to the truth?
Well, first we have to educate ourselves, and we have to recognize that there is no state in this country where it is illegal for a procedure to be performed that saves the life of a mother, but unintentionally results in the death of an unborn child. There is no time medically when the direct killing of an unborn child is necessary to save a mother's life. But there are instances where a procedure must be performed where to save a mother's life, where the child regrettably dies. Those are tragedies. And we all regret that that is the world that we live in. But every time that one of those procedures needs to occur, it is legal in every state. And it is legal in those states protecting life. We also have to recognize that we need to have an honest discussion about maternal mortality in this country, and that an honest discussion about it includes recognizing what abortion is doing to maternal health care. We now live in a world where there are doctors who do not care whether that child lives or dies because they have performed abortions. And so this changes the conversation around maternal mortality. We have an FDA that has approved a drug that sends 1 in 25 women who are pregnant to the emergency room following its usage. That is something that is certainly contributing to maternal mortality. And we can't begin to address the fact that in places like Southeast DC, there aren't maternal wards for women who are pregnant if we only focus on the fact that, as Democrats say, pro-life laws are endangering women's lives. An honest discussion about maternal mortality in this country has to include the damage that abortion is doing to maternal health care.
Mary, I just want to say thank you so much. You do an absolutely spectacular job staying on top of these issues, and what you've brought to the table today certainly is no exception. It's amazing. We have to continue pushing back on these falsehoods and keep pushing forward with the truth. Thank you for, in so many ways, being on the tip of the spear on that battle. Mary Szoch, Director of FRC's Center for Human Dignity, thank you for joining us.
Thanks so much for having me.